Hello and a very warm welcome to the Question Hour show from the Parliament House complex, the show where we bring you important unstart questions asked by the members of the upper house in the previous session of Parliament. I'm KRITI MISHRA and joining me is my colleague Rajat Kain.
Well, thanks KRITI and thanks to your viewers for watching this edition of Question Hour. It's a unique show where we get you all the questions asked by the MPs. Now, broadly speaking, there are three categories of questions: start, unstart and the short notice ones.
Well, absolutely. So, the start questions are those questions of which answers are given orally on the floor of the House by the respective ministers, and the members can also seek supplementaries. But unstart questions are those questions of which answers are deemed to be laid on the table of the House and written replies are given. And we bring you all important unstart questions from the 252nd session of the Rajya Sabha or the previous monsoon session of Parliament.
Well, what is the process, how these questions are asked and how these questions are answered? Here is a small presentation. A member submits his or her questions at least 15 days before the office of Rajya Sabha chairman. The Rajya Sabha Secretariat chooses the questions to be answered through a draw of ballots. Separate ballots are held for start and unstart questions. The questions are scrutinized for admissibility under the current rules and precedents. Advance copies of chosen questions are sent to ministry or departments concerned. The ministry concerns collect information to prepare the reply. The minister concerned reply to start questions on the floor of the House and provides written answers to unstart questions. Up to 160 unstart questions are listed every day in a separate list.
So, that was the procedure. But Rajat, let's begin the show now. And the first question in this edition of the Question Hour show is from Rajya Sabha MP Dr. D.P. VATS, and this question is to the Ministry of Health and Family Welfare. And the member has asked whether the government has brought in a new scheme for the COVID-19 warriors and the victims and the funds allocated for the same purpose.
Well, COVID-19 is one of the worst global pandemic of 20th century. Several countries has been hit by this health scare. This COVID-19 virus has impacted not just the health sector across the countries, but also the economy. In India, besides hitting the economy, it has also strained the health sector, and several measures, or to say initiatives, have been taken by the ministry. In the reply given by Minister of State for Health, Ashwini Kumar Chaubey, the minister says that there is a provision under Pradhan Mantri Garib Kalyan package for health workers fighting COVID-19. This is a central sector scheme. The scheme provides an insurance cover of Rs 50 lakh to healthcare providers, including community health workers, who may have to be in direct contact and care of COVID-19 patients, and who may have been at the risk of being impacted by this. It will also include accidental loss of life on account of contracting COVID-19. The scheme also covers private hospital staff, retired volunteers, local urban bodies, contract or daily wages, ad hoc outsourced staff requisitioned by state and central hospitals, autonomous hospitals of central, states, union territories, AIIMS and INIs, hospitals of central ministries drafted for COVID-19 related responsibilities. The insurance provided under this scheme would be over and above any other insurance cover being availed by the beneficiary. In addition, for treatment of those affected by COVID-19, government is implementing Ayushman Bharat Pradhan Mantri Jan Arogya Yojana to provide health cover of 5 lakhs per family per year for secondary and tertiary care hospitalization to around 10.74 crore poor and vulnerable families, which comes to be approximately 50 crore individuals as per socio-economic caste census data. To effectively cover Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, beneficiaries for testing and treatment of COVID-19, packages for testing of COVID-19 and treatment of COVID-19 have been notified. Well, KRITI, that was elaborate reply by the ministry on the steps taken in terms of COVID-19 pandemic.
Well, absolutely. And the questioner himself is joining us on the Question Hour show. So, during the previous session of Rajya Sabha, you'd asked a question on the new scheme for the COVID victims and warriors. In fact, the government has given a detailed reply. What is your take on government's response?
My take is that this COVID, you see, I am a doctor as well as a soldier doctor. and now, of course, a public representative. This COVID, I take it to be a form of biological war, where a hidden virus, which you don't see, and especially medical and paramedical fraternity, which is serving the patients, which is treating the patients, and which is preventing the spread of COVID with the public health, are certainly at a relatively bigger risk than the normal people around. And warriors they are, because they are fighting a very uncertain hidden enemy, that is this coronavirus. And it is contagious, it spreads by droplet infection, and it is quite dangerous, though hype is even much more. But certainly you see it spread last year, November onwards, from Wuhan city in China, and now in 218 countries. And around more than 5.5 crore people are infected. And out of them, fatalities, of course, in Western world, especially in USA, in England, in France, in Italy, in Brazil, the rate is much higher. But fatalities are there. Even in India, around 1,33,000 people have died so far. And in those people, you see doctors themselves, more than 600 doctors have so far sacrificed their lives. Now see, they remain in this PPE kit and masks, which is in itself is quite cumbersome and inconvenient, but they have to for hours together. At the same time, what matters is the total COVID, or you can say total amount or count of viruses entering your nasal tract, your respiratory tract, and your contagion. So certainly the paramedicals and medicals are on a much higher risk. And you will be surprised to know I am now speaking from a COVID hospital itself. This is the biggest COVID hospital, that is Maharaja Agrasen Medical College, Agroha, biggest COVID hospital of Haryana state, where 5 districts are dependent upon this hospital. And I am having 100 ICU beds, which are active beds. And doctors, nurses, Safai Karamcharis working round the clock. Once it is an infectious disease, whosoever comes in contact is certainly at a much higher risk of exposure. And that's why frontline warriors, Honorable Prime Minister Narendra Modi called for a national welcome and national salute for these semi-gods or demigods in white, we were called, and Indian Navy, Indian Air Force, and Indian Army bands, then fly past by Indian Air Force, and Indian naval ships also gave a national salute to the Corona warriors, in addition to the beating of various appliances and drums by the normal or common public in appreciation of their selfless, risky duties. I will say, though with full precautions, with utter disregard to their personal safety, they have delivered. And they are delivering, but they are getting martyred also, as I was mentioning to you. On this chair, now I am sitting, the previous incumbent here, Dr. Gopal Singhal, the director of this COVID hospital, himself died of COVID on 14th of October.
Okay, sir.
And my salute to those COVID warriors. But the way it is going on, like Delhi, there is a very high pressure. Earlier in Bombay, Pune, it was a very high pressure. Before the herd immunity develops and vaccination comes, the public needs massive protection and massive preventive measures in the form of face mask, social distancing or 2 gaz duri, and frequent hand wash to prevent droplet infection, aerosol infection, and contagion.
Sir, any specific suggestion to the government? Because I do remember that you had raised this issue even in the previous session of Parliament during the question hour.
My specific suggestions to the government are that rallies should also be virtual, even in elections. Now West Bengal elections are coming, then states keep going to elections. Till my rather suggestion is for a good or a better fiscal health, like Prime Minister has done, one country, one bazaar, same way, one country, one election, so that all those social distancing can be maintained and we can be busy for the betterment of our country, whether it is fiscal or defense. And I congratulate the defense forces also to create a very conducive security environment for the nation to fight COVID. In the end, my suggestion is the COVID frontline warriors need to be looked after even better. Central government has given us the seats, MBBS seats. State government should also give from their quota, even PG seats. Some state governments like Delhi and Odisha have added 50 lakhs insurance in addition to what central government has given. Other states also should follow the suit. And my appeal to the frontline COVID warriors is, when war is going on in its fiercest intensity, then we don't look for the remunerations from a mercenary zeal. Everybody comes to the missionary zeal. And when a nation fights with missionary zeal, the victory is assured.
Well, on that note, thank you so much for joining us and giving those details to us, sir.
Well, moving on to the next question that was asked by member Banda Prakash from Ministry of Petroleum and Natural Gas. The member sought details about the in-house production and also the imports of PNG and CNG gas across the country.
So this response has been given by Petroleum and Natural Gas Minister Dharmendra Pradhan, and he says that this information has been provided by Petroleum Planning and Analysis Cell. And it says that approximately 9,228 SCM of natural gas has been produced domestically and approximately 9,966 SCM of LNG has been imported in the country during the period April-July 2020. This gas also caters to demand of piped natural gas, which is PNG, and compressed natural gas, which is CNG. Petroleum and Natural Gas Regulatory Board is the authority to grant authorization to the entities for the development of city gas distribution network in geographical areas as per the PNGRB Act 2006. PNGRB identifies the GAs for the development of CGD network depending on the natural gas pipeline, which depends on connectivity or natural gas availability at techno-commercial feasibility. And at present, it has authorized 232 geographical areas in 407 districts of India for the development of the network. And let's move on to the next question asked by member Narayan Das Gupta, and this question is to the Ministry of Labour and Employment. And the member has asked about the job prospects for the migrant labourers.
Well, India witnessed a large-scale migration from cities to the homeland of migrant workers during the COVID-19 pandemic. Well, that fact pressed government and various agencies to draft or to say introduce several initiatives for the welfare of the migrant laborers, especially on the front of healthcare and employment. This ministry in particularly has given all the information about the steps taken for the migrant laborers vis-a-vis their employment opportunities in the annexures. In a reply given by Santosh Kumar Gangwar, the Minister of State for Labour and Employment, the minister says that to boost employment and livelihood opportunities for migrant workers returning to villages in the wake of COVID-19, the Government of India has launched Garib Kalyan Rozgar Yojana on 20th of June 2020. The Abhiyan focuses on durable rural infrastructure and providing modern facilities like internet in the villages. Skill mapping of rural migrant laborers is being done to help them work closer homes. The Abhiyan involves intensified and focused implementation of 25 target-driven works to provide employment and create infrastructure in the rural areas of 116 districts of 6 states with a resource envelope of Rs 50,000 crore. Well, as per the data available, total employment generated under Garib Kalyan Rozgar Abhiyan from 20th June till date, the total expenditure of Rs 22,761 crore has been spent. Apart from this, the Ministry of Women and Child Development has launched various schemes for migrant workers who have returned to their native places. One of the schemes is Anganwadi services, which has been extended to children of migrant workers. Ministry of Food Processing Industries have sanctioned 700 food processing, preservation and infrastructure projects in which migrant laborers may get employment. To provide employment to migrant workers, Ministry of Transport and Highways has identified the ongoing works, new works for this road construction. Ministry of Steel assisted migrant workers and their families with food packets and face masks, milk powders. The Department of Biotechnology has set up 30 biotech Kisan hubs in the country covering all agroclimatic zones, 150 districts including 101 aspirational districts, which will help migrant workers to earn their livelihood through farming and expose them to the innovative methods of farming of high value crops. Well, moving on to next question that was asked by member Kumar Ketkar, and the question was asked from Ministry of Home Affairs. The member has sought details of civilian casualties post revocation of Article 370 in Jammu and Kashmir.
So this response has been given by MOS Home Affairs, Mr. G. Kishan Reddy. And as we know that Government of India has adopted zero tolerance policy towards terrorism. In fact, after revocation of Article 370, we've seen decline in number of such cases, and the government has taken several steps to ensure peace in the valley. And in the response, the government says that the number of civilians killed and security personnel got martyrdom during the period 5th August 2019 to 10th of September 2020 in Jammu and Kashmir are, so the civilians killed in the terrorist related activities were 45 and ceasefire violations were 26, and security personnel martyrdom was 49 and ceasefire violations were 25. The government has adopted a policy of zero tolerance towards terrorism and has taken several measures such as strengthening of security apparatus, strict enforcement of law against anti-national elements, intensified cordon and search operations to effectively deal with the challenges posed by the terrorist organizations, while keeping a close watch on persons who attempt to provide support to terrorists and initiating action against them. Other steps by law enforcing agencies include enhanced interaction between police and public at various levels, sharing of intelligence inputs on real-time basis amongst all security forces operating in Jammu and Kashmir, intensified area domination of militancy affected areas by deployment of additional nakas and patrolling by security forces. In order to bring about overall development for the benefit of people of Jammu and Kashmir, Prime Minister had also announced a package of 80,068 crore rupees under PMDP 2015. This package consists of 63 major development projects in road sector, power generation and transmission, health infrastructure, establishment of 2 AIIMS, IITs, IIMs and tourism related projects. These projects are at various stages of implementation. Training and employment opportunities for the youth of Jammu and Kashmir are also provided under many schemes such as Himayat and Pradhan Mantri Kaushal Vikas Yojana. And the government also says that in order to mainstream the youth, special emphasis is given on Watan Ke Jano program and also sports and students exchange program as well as civic action of the Central Armed Paramilitary Forces. And now let's move on to the last question of this edition of the Question Hour show, and this one has been asked by member Parimal Nathwani. And the member has asked whether there is shortage of IPS officers in the country, specifically in the states of Andhra Pradesh, Gujarat and Jharkhand. And the member has also sought details about the action taken by the government to clear the legal hurdle, if any.
Well, in a precise reply given by Minister of State for Home Affairs, Nityanand Rai, the ministry says that there is neither any shortfall nor there are any legal hurdles vis-a-vis the Indian Police Service officers across the country. The reply further reads that as on the 1st of January 2020, the authorized strength of IPS in country including Andhra Pradesh, Jharkhand and Gujarat is 4,982, against which 4,074 officers are in position. In Andhra Pradesh, Jharkhand and Gujarat, 115, 121 and 169 of IPS officers respectively are in position on the 1st of January 2020. There is no such proposal in the ministry for induction of officers of armed forces and paramilitary forces into Indian Police Service or the IPS. However, the induction of state police officers into IPS is conducted on yearly basis under Sub-Rule 1 of Rule 9 of Indian Police Service Recruitment Rules 1954, read with subsection 1 of Regulation 9 of IPS Appointment by Promotion Regulations 1955. In order to reduce shortage of IPS officers, the batch size of IPS, that is direct recruit, has been increased from 88 to 103 from Civil Service Examination of 2005, 130 from 2008 and 150 from 2009. Besides the above, the process of appointments to the Indian Police Service by promotion from State Police Service has been accelerated. Well, there you have Minister giving a precise reply about the number of IPS officers across the country and if at all there is any legal hurdle in increasing the positions for IPS officers.
So Rajat, these were the important questions and answers for our viewers in this edition of the Question Hour Show.
Well, thanks for watching this edition of Question Hour. Stay safe. Thanks for watching Rajya Sabha TV.